Good afternoon, IIT Hyderabad. Hope I'll not put you all to sleep post heavy lunch. After almost 10 years, I think I'm on a dais addressing students especially. Public speaking, I would say. Okay, I'm Yasaswini Jonnalagadda, an entrepreneur by profession and a social worker by passion. I'm an electrical engineer and an MBA graduate. I've worked in many MNCs for 9 years and currently running a startup along with my husband. I feel very honored to be on this platform today. I'm here today to share my learnings about building a self-reliant society, especially my learnings during the last 2 years of living with COVID-19 pandemic. Since my childhood, I would say since young age, I wanted to do something good for the society, like most of you here. When I started earning on my own way back in 2005, I used to support few girl children in order to pursue their education, but I wanted to do something more. I think it was in 2011 during my MBA days, I realized that I could do a lot more. We used to have an elective in our MBA called Karma Yoga, taught by Professor Venkat Krishnan, whom I consider my guru. So the real meaning of Karma Yoga taught by him, selfless actions performed for the benefit of others, still resonates in my mind. As part of this course, I just want to throw up some light on this course. As part of this course, a group of 10 students were made and these students were allotted a village. So our job was to go to this village, talk to the villagers, understand their problems and try to come up with certain solutions. Born and brought up in urban areas, my interaction with villagers introduced me to many issues which I was unaware of. So we thought, okay, what could be their problems? So some of the problems were quite shocking to me that they had very limited access to education, healthcare, and also many infrastructure facilities which were posing a problem for them on daily basis. So we thought, okay, let's address at least few of their problems. We spoke to a private hospital and we set up a healthcare center at our village. We motivated many families to send their girl children for higher education post their teenage years. These changes gave me a confidence and I started believing that, yes, I can do better things in future. And then fast forward many years, I was happy and I was doing well both professionally and personally, a caring and loving husband, 2 beautiful daughters, a very supportive parents and in-laws. So everything was going well, all good, enjoying your own luxury life, but I felt there was something missing. My mind was going back to my MBA days, whatever I learned there, and I had a question pondering in my mind. Whatever I learned, could I really implement that to create a better and self-reliant society? But how? Then there was a pause. And 2 years back, COVID-19 happened, which changed many lives overnight. Luckily, my family was not affected directly, but we could see many others who were not so lucky. When we saw the news coming out about the plight of migrant laborers who were stuck in Hyderabad and were actually trying to get the minimum basic need of food, we couldn't sit back. We started distributing 40 to 50 food packets every day from our home. Then we realized that pandemic, almost we could not see an end soon. So we thought we should do something more than this. Again, back to the question, how and what? Never ever future was uncertain. This was the period when I came across an initiative called Rice ATM, started by Mr. Ramu Sapati, who is a HR professional and a social worker. He was already a known face through his initiatives like No Plastic Challenge and Tiffin Box Challenge. I rang Mr. Ramu and I spoke to him and expressed my interest to be part of this initiative, to which immediately he agreed. Then I was very happy to be there. You know, everybody needs certain platform to serve, and I felt this one was for me. RICETM was started in April 2020 with the motive to feed the migrant laborers who were stuck in Hyderabad during the lockdown. But when we saw more people coming to us, we realized that we have to come up with something which will stop these people being exposed to the infection. That's when we decided that let's come up with a monthly grocery kit scheme to the COVID-affected families so that they'll not come back to us at least for a month. And during this distribution of groceries phase, we realized that this is going to be an unending process because most of us who were coming to us were either they lost their jobs or they lost the sole breadwinner of their family. Then, you know, lot of brainstorming and all, we wanted to come up with something which is sustainable. So, and when we started talking to them, we tried to understand their needs, what they want, what they are capable of. After jotting down everything, in the mid of September 2020, we started designing a concept and identifying the families who are really in need of our support. And we designed this livelihood project after mapping the capabilities of an individual to their suitable work, and we came up with something called Project Prisha in January 2021. Prisha is nothing but the boon of God, gift of God. Prisha is name of my younger daughter, so we launched it on her birthday in Jan 2021. So under Project Prisha, first we started with these women who were tailors working in small firms, and they lost their jobs because COVID-19 forced these firms to shut down. Then there were some cooks who were working at small cafes and hotels, and they were sent out because those cafes were shut. So we started distributing the sewing machines to those women who couldn't afford to buy one on their own. Then we started setting up catering services for the cooks. And slowly, apart from these, we started setting up flour mills, vegetable and fruit carts, tiffin centers, food points, juice points, so many things. Then we could see, you know, we were so excited to see the happiness on the face of our beneficiaries. They regained their confidence. They were so happy that they could again start their life afresh. When the word of our initiative started to spread, there was a lot of support started coming in from family and friends. Moving forward, we supported more than 1,000 families under Project Prisha. It's not an NGO, let me be clear here. It's our personal project which we took up along with RICETM. So we have 1,000 families, at least 1,000 families today, who took support from us and have become self-sufficient. And we distributed more than 10,000 rice bags under RICETM initiative. And more than 50,000 families were benefited under grocery distribution initiative. And during the last 3 phases, we distributed around 10 lakh meals to different hospitals, people stranded at bus stands, railway stations, and many more. When we look back, we feel that it was not at all an easy journey. I was infected with COVID twice, with being hospitalized for more than a week during last wave. When I was hospitalized, my first worry was, okay, my family is there to take care of my children. Though yes, as a mother, I should be around. But what if I'm not able to give more to the society? Then I realized that there is very less time to do more. I cannot really bear one more wave and getting hospitalized again. Even Mr. Ramu, whom we partnered with, even he sacrificed a lot of his family time and lot of luxuries which he could have given to his family in order to support others. There were many who criticized us that we were giving freebies and making people lazy. But our intention was good, and what we believe is we did right thing at the right time. When somebody is hungry, you cannot ask them to go and find a job. You should first feed them. You should make them efficient to go and look for a job. Anyways, I think right now the things are going to be normal. I think they're almost normal, but still we should be watchful for the next wave and be prepared for it. We have cut down our activities related to Rice ATM and Project Prisha for now, but we are coming up with new initiatives. We are going to concentrate more on the education and health care for the girl child. I believe it's not going to be done by a single person or just us or few of us. It should be a mass movement. All of us should take that responsibility and ensure that we help a girl child, because empowering a woman will empower the society. So, last couple of years have actually indeed taught me that yes, we can surely make a self-reliant society, because out of these 1,000 projects which we did, which we helped people, at least 800 were women, and most of the women were either lost the male in their family to COVID, or were abandoned by their husbands because they had girl children. I think that this was not their mistake. So, and today, these people who took support from us are helping others. So it's not just us, more than 800 families are helping more than 3,000 families today. So my learnings taught me that indeed we can make a self-reliant society. Yes, it's definitely possible, and I believe you believe so. I would like to end my talk by quoting one of my favorite quotes by Swami Vivekananda. Arise, awake, and stop not till the goal is reached. Thank you.